I think the moment that I knew that I was going to be a future hospice and palliative medicine physician was when I witnessed a palliative care physician interview a patient. It was astonishing how quickly he built rapport with a patient who was pushing my team away at every second she can get. And with just 3 words, "Tell me more," he opened a world and I realized this was what I wanted to do. More than a decade later, I'm so thrilled that we're launching a Hospice and Palliative Medicine Fellowship here at the University of Vermont Health Network.
One thing that makes our fellowship unique is the ability to both work in an academic medical center and also have the opportunity to work in a small rural critical access hospital that's affiliated.
One of the beauties of being in a relatively smaller space is that you get to know your faculty, whether or not they're from your own division. And I find those relationships are a big clinical opportunity for fellows who might have some burgeoning interests of their own.
The opportunities to collaborate on your patient's care, no matter what setting they're in. So whether they're at home or in the hospital or following up with their PCP is really incredible. And that's, I think, a big part of palliative medicine is following people over the trajectory of a serious illness rather than just one visit.
There are 4 main elements to our Hospice and Palliative Medicine Fellowship here at the University of Vermont Health Network. The first is our diverse clinical experience. The second is our academic half-day workshops. The third is our opportunities for leadership growth. That's either in the research setting, quality improvement, or in the educational setting, training fellows to be future teachers. And the last is our concentration on wellness and resilience through weekly workshops.
Fellows will have clinical opportunities in the fellowship to work with our primary division team, both as a consult service and in an attending role at the Miller McClure Respite House for caring for patients and their families who are enrolled in hospice care.
The other nice thing about the McClure Miller Respite House is that all of the disciplines are kind of there under one roof, working together organically. So there's a social worker and a chaplain. All the volunteers are there working right alongside the nurses, the nurse practitioner, and the physician.
We also do a lot of work at Helen Porter, which is a skilled nursing facility where we have both long-term care residents as well as individuals that are there in the post-acute setting. And so for me, being able to see people in both of those settings and being able to have some continuity with them and follow them over time, I think is so critical and will be a wonderful opportunity for our fellows to really learn what it means to follow people through the course of an illness.
We are looking for future colleagues, someone who is open and curious, who's humble, who embraces diversity.
Equally, if not more importantly, has the skills to be able to sit with patients and families and to listen deeply and discern what matters most and find a way for us to bring those 2 things together. The best that medicine has to offer, what's important to patients, and helping with that transition.
What I love about working in Vermont is being in Vermont. This is just a beautiful place to live, to work, and it provides, I think, a really built-in opportunity to, be a person and a professional and raise a family in a place that is just joyful to live in.
I specifically wanted to be in the Burlington area because it has the best of both worlds, of like a rich downtown with good restaurants, lakefront, music.
Living and working in Vermont means that I can bring my best self to work and give it my all, and at the end of the day, I can take a 10-minute drive home with beautiful scenery and take a walk or ski or do any other number of activities that really help sustain me. It's wonderful. I can't imagine working anywhere else.
Fellows who are interested in fostering that curiosity and learning what they don't know about other people, about themselves, about this practice of medicine, I think would find a home here and really could contribute to the breadth of our team and the breadth of experience and perspective that we so welcome.
People here have a commitment to making every patient's life better, finding the brightness in every dark spot, and certainly also having the opportunity not only to utilize a research center, an academic medical center, but also to experience community-based palliative care in rural settings.